You're listening to the We Are Libertarians podcast network. Find all of our shows at wearelibertarians.com.
Episode 93, The Paradox.
Welcome to The Paradox with your attending, Dr. Eric Larson. He is a practicing anesthesiologist and clinical assistant professor at Michigan State University College of Human Medicine. Listen in as he takes you behind the scenes of what practicing medicine in today's ever-changing world is like with another doctor. The Paradox is a fun and accidentally informative show for physicians, patients, or anyone who has ever found themselves in a waiting room.
Welcome to The Paradox. I'm your host, Dr. Eric Larson. Thank you for joining me as we explore the U.S. medical system in a fun and informative format through expert analysis. Today's expert is Zeller, president of Scriptco, a fully transparent, subscription-based generic medication pharmacy based out of Texas. I'm sure you'll find this discussion as exciting as I did, as this is yet again more evidence that people are doing innovative things within the healthcare arena to cut costs and provide tremendous value for patients. Scriptco's business model is one where you almost slap yourself in the head and think, why didn't I think of this? But it's such a brilliant idea, simple and effective, and you're going to see how it has the potential to reach and touch a ton of people in this country, and I'm certain you'll find it as intriguing as I do. As a reminder, all the show notes can be found at theparadox.com/093. We are closely approaching the century mark, which I can hardly believe. I'd also like to announce the exciting news that I will be joining the Doctors Podcast Network. We're going to be affiliated with other podcasts run by physicians, which will allow me to grow this show so much more than I had before, and it's something I'm super excited about. I hope you are too. I'd encourage you, if you have not yet, to pause and subscribe to the show on your podcast player. Make sure you share it with your friends, continue sharing it on social media, and have your friends not only listen to this show and an episode, which I think is great, but also look over the titles and find a couple other episodes that they find intriguing. There are lots of different discussions we had on all aspects of medicine, not only the delivery system, but also a wide range of topics, including physician suicide, burnout, forced organ harvesting, is brain death really death, as well as entrepreneurial doctors, and even some finance. Oh, and a few times talking about COVID. I have some really great interviews lined up in the future who I think you'll learn some more about the delivery system. We're going to talk a little bit about COVID, and we're going to keep this thing rolling all the way through 100. But without further ado, Zeller from Scriptco on how they're going to disrupt the entire generic medication market. Enjoy. Well, hey, this is Eric, here with my new friend, Zeller. Zach is the president of Scriptco Pharmacy, which is an online, I guess we'll call it, pharmacy. We'll kind of get into that a little bit more. Super excited about this because, as you know in the show, we talk about innovative ways of delivering medical care and medical supplies and things. And so this is clearly right up that alley. So, Zach, thanks so much for coming on the show.
Absolutely. Thanks for having me today, Eric.
Well, why don't you talk briefly about what Scriptco is? Because I think it's fairly, I guess, new. I mean, I've not heard of anything like this before. And so why don't you explain to the listeners what exactly it is that you guys do?
Absolutely. So Scriptco is a mail order pharmacy, and we operate a little bit differently than any other pharmacy in America. We transparently disclose the actual wholesale cost of any non-controlled generic medication. And as a member of Scriptco, anyone can buy that medication at the actual wholesale cost. So Scriptco only derives its revenue from memberships and not medications. So really, in a nutshell, it's a transparent wholesale pharmacy.
Yeah, only in America would actually telling people the price of something ahead of time be seen as like revolutionary. It's only in medicine, right?
Yeah.
I mean, it's kind of stunning that it's. So I have I have a direct primary care physician. I think we talked about this before offline, and also I have a health sharing. So I actually don't have insurance. I'm kind of one of those weird physicians who doesn't have my own insurance, but. So I have to do a lot of price shopping, and it comes down to using apps and calling all the pharmacies, and it's amazing the difference in price for the same generic medication. I'm assuming most of the wholesalers are fairly similar in pricing, but that you can see a almost 6 times markup from one, and it's also random from one pharmacy to the other. You won't find one that's consistently higher or lower in town. I mean, I guess, well, you said and also offline you mentioned that you you have traditional retail pharmacies as well experiencing that. So how does that sort of thing happen?
So there's a middleman that not very many people know about, and they're being talked about more and more, obviously, as time goes on. But there's these middlemen called pharmacy benefit managers,
right.
And there's three large pharmacy benefit managers, and that's Optum, Express Scripts, and Caremark CVS. And between those three, they do over $1 billion a day in revenue. Optum, half of Optum's total revenue half of United's total revenue is derived from their PBM, Optum. And this is all stuff you can go look up.
Yeah.
And so it's a very complicated relationship. It is like the ultimate fox in the hen house, between the insurer, the pharmacy, and the pharmacy benefit manager. And a lot of these larger corporations, and I won't name them, but if anyone wants to do some research, they can find out that they own the insurance company, they own the PBM, and they own the pharmacy. And so it's a little malalignment, from the consumer. And so ultimately the reason that prices are just so wildly fluctuating, and when you look at our prices versus, even a traditional insurance copay, I mean, lisinopril is a perfect example. So if you look at nationally, the average copay for a 30-day supply of lisinopril, it's $15.
Right.
And with Scriptco, lisinopril is literally 30 cents for a 30-day supply. You can get a whole year for $3.65. And it's just the actual wholesale cost, right? And so it's a markup created by a middleman who sets a price versus transparency and access. And that's really the reality of the market.
It's so hard to me to wrap my head around the fact that there's this really big market availability for someone like you to come in and say, well, we have a membership price. You pay to be, you pay us a fee every month, and we'll just provide those medications for you.
$120 a year.
Yeah.
$120 a year or $45 a quarter. That's it. It's that simple.
It's so easy, and that you actually have room. I mean, you're doing that. I'm assuming you're making money, so there's obviously room there for that you can make a profit. It just shows what the amount of slack, I guess you'd call it, in the system, that they can charge so much more. I noticed once I get my medications in Michigan, we're allowed to get our physicians allowed to dispense medications, a direct primary care physician. So she charges 10% above wholesale to cover her costs for getting all the hassle or whatever. But even with those prices, it's not even. I saw what I was paying for the same medications with my insurance the year before with copays, and as you say, the copay the price was probably 3 or 4 times, if not more, than what I pay now. It's really amazing.
Absolutely. So one of the reasons this company started, and really the tipping point for this whole thing, was my bride, Amy, came to me and said, hey, we're paying $44.37 per pill for my elatriptan. It's a migraine medication. It's made by Teva. It was 40 milligram. And she was like, can I get it cheap through your pharmacy? And I thought, well, no, I know you can't, because the insurance price is the insurance price no matter where you go if you're using your insurance. But I said, well, we'll just buy it at the wholesale cost and dispense it that way, right? And so I go and look up Teva, 40 milligram elatriptan. So we're paying $44.37 a pill, and the wholesale cost is $2.99. And you're talking identical pill, identical manufacturer. It is the same thing through insurance. You pay $44.37, and the actual wholesale cost is $2.99. So that one medication alone saves us over $1,800 a year using Scriptco over our Humana plan.
Yeah, I know. You hear these numbers, and again, it's hard to really believe, because the savings are so tremendous. And I always look at that and I think, why has no one else done this before? I mean, do you think it's is it because people thought, well, there was no deductible pressure before, people weren't really shopping around much for medications, or I just don't know. I mean, it's because there's been mail order pharmacies for quite a while, so that's nothing new.
Yeah. I mean, I think that ultimately, once I dove in and really I did a ton of research for 3 weeks. I mean, I was up till 2-3 o'clock every night trying to understand economically how to bring a solution to market that creates access for everyone and drives costs down, and that could potentially move the market, right? And so I was researching percentage of medications dispensed, statins versus just going literally across the board, and really I had this like spider web in my office on this wall over here of stuff I was trying to figure out. And really when it boiled down, the only way that you can really just hammer the market is to create transparency, number one, and create access. Well, the reason you can't do that in the traditional insurance setting is the pharmacy benefit manager won't allow it. And so you have to get out of the insurance environment to do it. And so, I was racking my head against the wall, and I thought, man, the best way to do this, everyone's used to it. Let's do a subscription model, and we'll derive all the revenue from the subscription model and give the actual transparent wholesale cost in a quote calculator on our website. And that's exactly what it is. Anyone can go to scriptco.com. They can look up the actual wholesale cost of any non-controlled generic medication. We have no formulary. As long as it's generic and it's not a controlled, you can get it through Scriptco 100% of the time. We're really excited about it. It's been hugely disruptive already. We're getting phone calls left and right from people you'd think you'd never talk to. So it's been a ton of fun.
It must be a lot of fun just having a concept that you thought, well, it makes a lot of sense. You figured it out, and it's going to provide tremendous value to people, to transform people's lives, right? I mean, they suddenly have a lot more disposable income that now they can get all those medicines. Maybe they had to make choices. Now they don't have to.
Yeah. Yeah. I mean, helping people in our minds, one of the most fun things on earth, right? I mean, we've all had stuff, and I don't think anyone can look you straight in the eye and say that stuff can love you back, but humans can. And so helping people, man, that's as good as it gets. And being able to create a viable business out of helping people in a potentially tremendous way is just, you wake up every morning ready to start swinging at people. So it's fun.
Yeah. Well, and that's why we go to medicine. We go to medicine to help people, and you go into business and into the market to provide people value for that they, it's going to change their lives, maybe dramatically, maybe not, but that's sort of the great thing about this. So I look at your website. Obviously you're not, well, I guess the first question, how long have you been open?
So we opened October of 2019. We did friends and family through 19. So just to make sure that our systems were functioning correctly. And then started doing a little marketing in January, and Fox News in DFW kind of got a hold of us and said, hey, we want to know a story about this, but we got to learn more and make sure this is real, because it really seems too good to be true. And we're like, we get phone calls every day about people saying there's no way this is possible. It's too good to be true. And we would have people call genuinely and not sign up because they thought something funny was going on. So, Fox ran a story on us, a 5-minute segment, and did a ton of, they looked everywhere. They called wholesalers that we buy medications from. It was a 1-month workup to them actually coming to the pharmacy and filming. And then once they came and filmed, Corona hit, and it kind of slowed things down a little bit. But then they actually aired the story May 13th, and since then it's just been a rocket ship.
That was, if you had tried to plan to actually do a commercial, you couldn't have done a nicer commercial than what that story was. They found people who have a lot of medications, and show the tremendous value and the potential for this product. Right now you're available in, I think, 7 or 8 states. It looks like
8
Texas,
states,
Massachusetts, Idaho, Nebraska, Illinois, Utah, Arizona, Kentucky. Sorry, all my Michigan listeners. You're working at Wisconsin. What is the limitation there for getting into states? Is it a state regulatory problem?
So the limitation just comes down to time and money. We're actually doing a fundraise right now, and we've got verbally some money that we're raising, and we expect to start getting checks in the next week or so. And so once we get our first fundraise check, that there's a certain amount of money that we're setting aside to give to a third-party company that can do the rest of the licensing for us, and we'll be licensed in all 50 states by December at the latest.
And then I know you were, again, offline, you were mentioning about some other functionality you're going to have with it. Right now it's just a website or a mobile phone, but I imagine you mentioned something about an app. What's coming up with that?
Yeah, so we'll have the first fully functioning mobile app that allows you to literally do anything you can do over the phone, right? So you can request refills, You can pay for your medications. You can pause your medications. You can look at your medication order history. You can look at your medication payment history. You can talk to a pharmacist without actually dialing a phone number. It actually dials it through the system. You will also be able to, did I say request refills? I think I said request refills.
Yeah.
And so really it's an all-encompassing solution. Again, to access, if you want to price a med in the app, you can price the med in the app. You don't have to be on the website. So it really does everything, as well as your membership, right? So your membership information is all in there. So you can change from a quarterly to an annual, or annual to quarterly, or pause it, or completely nix it, whatever you want to do through the app.
We talked about pharmacy benefit managers quite extensively in this show, episode 5 being the first one. That'll be linked to in the show notes at theparadox.com/093. But when it comes to pharmacy benefit managers, it's the, I think when most people think of like a grocery store, I always use this as an analogy because I think it's the simplest. When you go to the grocery store, you know how much a banana costs. You go across town, a banana's pretty much the same price. It's about, 8 cents a banana or something. And many of the people are pushing right now to try and get increased transparency within the system to know what the contract prices are from insurance companies and the maybe the surgeries or the hospitals or the physicians. But ultimately, consumers don't really care about that. I mean, if you think about it, you don't really go to the grocery store and wonder how much that grocery store is spending on bananas, right? All you care about is the price that you're paying when you go into the store. And you know that with the market, since they're fairly transparent prices, the prices are going to be fairly similar within the market. I mean, there might be some higher end grocery stores, nicer bananas or whatever. You don't care if the store's getting it for 1 cent or 2 cents and so in medicine, for whatever reason, we're pushing to try and get that exposed. When a much simpler thing was just, why don't we just have the price at the end be known? And then you don't have to spend all this time trying to decipher contracts between insurers. Do you feel like the safe harbor laws are going to make a significant impact? Because I know Trump just recently signed an executive order to repeal Safe Harbor Act, which to provide some sort of protection for these PBMs and insurers. Or do you think it won't make much difference because ultimately there's not much transparency, which is obviously my position, but I'm curious what you think.
Well, there's some bigger PBMs in the marketplace that just started GPOs in Switzerland and a couple other places literally within the last 45 days. So I have a sneaking suspicion they already have another idea for how they're going to pivot. Because, I mean, when you have revenue of over $1 billion a day, I think you can build a lot of lobby in your favor and understand where the market's going before it actually goes there. And I personally don't think PBMs are going to go away silently. I think they have way too much control, and I think they have so much capital that it allows them to make pivots that continue to support their, overhead.
Sure. Yeah. Oh, that's my impression too, that they have the lobbying ability to move legislation and regulation, at least to protect them or allow them, as you said, allow them some sort of exit so that they can still maintain the revenue stream in another way. But as long as you have a system that is designed to have a third party paying for things, you're going to have a very sort of circuitous way of figuring out costs. Right.
Right.
What do you think the plan is for you with like states that dispense? I know with like direct primary care, my physician can dispense medications. I recognize that direct primary care physicians are a very, very small portion of the market at this time. And they can, most states, not in Texas, but in most states, they can dispense medications.
Right.
What do you think their role is with a Scriptco? Is that something that you think that they use and they don't have to worry about dispensing in their office?
We already work with several different DPC physicians that are happy to not have to dispense medications anymore, frankly.
Yeah, sure.
Because they really are trying to, make an impact in the marketplace, and for their member to be able to pay $120 a year and get medications actually typically a little cheaper than they can get them for, because we have a little bit more buying power and a little bit more know-how, because we've been owning and operating traditional pharmacies, like I said, as a group for over 25 years. So, some of them that get territorial about it are probably making money somehow, because otherwise, if they truly are, if it truly is a break even for them, they want to push it off as quickly as they can, because all it is work, you know. So the other thing is too, a lot of them don't have every single medication they may potentially want to prescribe, right? Whereas at Scriptco, as long as it's a non-controlled generic, you can get it through us. You can access any non-controlled generic through Scriptco, because again, we don't have a formulary. We have a 3,600 square foot pharmacy that houses a boatload of medications. And if we don't have it, we order it and we get it the next day.
So give people a little look under the hood as far as wholesalers, because I think, you know, unless you're in the pharmacy business, you don't know how that actually works. Are there lots of wholesalers in the country? Is that, and how do they just contract directly with the pharmaceutical manufacturers in the generic plants? I mean,
absolutely. So this is the top supply chain of pharmacy in America, right? So you have brand name manufacturers and you have generic manufacturers, right? Those branded and generic manufacturers, 99.9% of the time, sell to a wholesaler, and then the wholesaler sells to the pharmacy. So that's the top line of supply chain in America: brand or generic to the wholesaler, wholesaler to the pharmacy, right? Then you think about the pharmacy is kind of in that top right-hand corner of the piece of paper, and in between the pharmacy and the patient, down in the bottom right-hand corner, is that pharmacy benefit manager, right? So pharmacies are used to buying directly from the wholesaler. We currently work with 38 different wholesalers to try and drive the lowest price every time. There's what are called primary wholesalers and secondary wholesalers. Primaries are your massive wholesalers, like your McKesson, you know, your Henry Schein's. Oh gosh, I'm totally blanking on the name of the other really big one. That's embarrassing. Anyways, it's Sunday. I haven't had enough coffee. Okay. The other really big wholesaler, which I'm sure I'll blurt out in a second. Those are examples of primaries, right? But ultimately, primaries and secondaries supply the marketplace, and you know, not everybody always buys from a primary. You know, you can buy back and forth, because a lot of times the primaries have higher prices than secondaries, and it's still the same manufacturer, it's still the same medication. It's just, you know, we're all buying Reeboks. It's just, did you buy Reeboks from, you know, the Finish Line, or did you buy Reeboks from, you know, the Reebok store online? It's still the same shoe. So ultimately, the supply chain is very tight when it comes to wholesalers. They're regulated very heavily by the FDA, and they get, you know, and not investigated. They get surprise visits to make sure they're
inspected,
doing everything, inspections. And so as long as you're buying from a U.S. based wholesaler, you know, it's a very tight supply chain.
And I assume you use all U.S. based to make it simpler for your licensing and things.
Yep.
I mean, I don't know if this is even, if you're allowed to say this, but as far as the demographics, what do you have for demographics as far as like age? Do you have people who are, say, in their 60s and 70s who are members, because even though they're on Medicare?
Absolutely. So we have a woman who signed up who's 96 years old, all on her own, went through the join process, and she's getting all of her medications from us. And we have, you know, people that are as young as, you know, well, there's people that have been kids that have been signed up by their parents. But our median age actually is 55. So when you look at all of our members, the average age is 55 years old. So, you know, you could have that member for 20, 30 years.
Sure.
Over the course of their, you know, maintenance medication usage.
Right. I mean, obviously, people who are young generally don't have on a lot of medications, but those who are older do. But you know, people always assume, I think, with Medicare that your medications are free or that you're not getting. But there's a lot of shopping. I mean, it's not even close to that, and which is why I always find it funny when people say Medicare for all. They assume everything is totally free. Like they have no clue. You have no idea.
I mean, people who think that way, you know, not to sound rude, but it is absolute ignorance. It's someone who says that has no clue what they're talking about. And if you're in the know and you hear someone say that, you know, I'm just like, oh, I gotta bite my tongue, because, you know, I don't don't navigate the political correctness waters as well as I used to. And it's like, I don't try and be ugly about it, but it's like, man, I just wish people wouldn't make statements about things they know nothing about, because it is very challenging, creates a lot of chaos in the marketplace because it just creates misinformation.
Where do you see your company in, well, I mean, obviously by the end of the year, you're everywhere. You're throughout the entire United States.
Mm-hmm.
I guess, do you have a lot of extra, I'm just trying to think about whether competitors, I mean, how much disruption are you seeing from your company? Like, do you see it mostly locally in Texas, or, I mean, I'm sure people are upset, but
yeah. I think we'll have over 1 million members in Scriptco within 3 years, easily, frankly, just based on the numbers we have now. If we continue to grow the way we're growing right now with minimal marketing, right? I mean, our customer acquisition cost is almost nothing right now, and in 3 years right now, if we didn't grow it off, we just continued growing the way we're growing, we'd have about 150,000 members in 3 years. And that's without pouring any gasoline on the fire. We have a lot of tricks up our sleeves to really get the word out on this in an impactful and meaningful way. And, we just want people to be able to save money and live a better life and not have to worry about the cost of their medications. I mean, it is unfortunately a normal occurrence to have to worry about your meds and their costs. It's constantly changing. It's scary. And money is not an easy thing to come by. So we just want to get the word out and really hammer this thing home. And we have a really good plan to do so.
Yeah, I think it'd be interesting for the listeners, you go to scriptco.com. Again, the link will be on the show notes, but just to type in the medications you might be using or in your family, and just to get an idea of how much they are. Because I know with my family, 5 years ago, we had your traditional HMO plan. Then we got moved to an HSA, and as soon as we moved to an HSA, we started shopping around more for medications and just be more, conscious of the cost. And I think most Americans like this, right? For most of our lives, we really didn't pay any attention to the cost of anything because it was a copay, and you made the fairly simple assumption that is, oh, well, it's got to be cheaper than, paying the retail price of the medication. But now within HSA, you recognize the difference in pharmacies, obviously. And now that I don't have any insurance, I'm much more conscious of my costs. And it's startling, the difference. But I would encourage you to just go and look, because you may think insurance or prepaid healthcare, whatever you want to call it, is the best way to go. But when you look at the costs, you're 9, 10, 20 times difference in costs. It is really startling. And again, it's so big that you don't even think it's possible.
Yeah, you're absolutely correct. Yeah, I think, again, no matter what you're talking about, educating yourself on whatever topic you would like to know about is critical, right? And the only way you can truly educate yourself is by taking some time to understand all the sides of the story and then make your own decision about how you think about something. But ultimately, you can't get there without educating yourself.
And the first thing is a little bit of a curiosity to find out what's going on. Any parting thoughts? Any things you'd like people to know about your company? I mean, I just found out about you like 2 weeks ago, and I was super excited that someone's doing something like this. What other things you got? Have you got out there?
Yeah, so we're just excited to be here and be a solution. We are bringing to market also a telehealth solution that will be $20 a month for the entire family. You can have unlimited visits to primary care and urgent care. So we'll have a telehealth solution also to try and drive down the cost. And then, lastly, everyone gets 4 free shipments a year as a Scriptco member. And we try and create some parallel incentive between them and us, because if we can dispense 90-day supplies every time, it makes our pharmacy much more efficient. And so we can save our members money also, right? So our goal is to med sync everything, ship everything all at once, and get four shipments out to our members a year. And then they don't have to ever pay shipping.
I, again, encourage everyone to check out Scriptco.com. Zach Zeller, president of Scriptco, thank you so much for being on the show.
Thank you so much for having me, Eric. I appreciate the time.
Thanks for listening to The Paradox. If you like what the doc is doing, please subscribe and leave a review on iTunes or Stitcher. and share the show with your friends. Become a supporting listener to get access to special bonuses at patreon.com/theparadox. Show notes can be found at theparadox.com.